life around me was gray. Yeah, I mean, I wasn't depressed, but everything, there was no vibrance to life. I just had a hard time understanding people. I had a hard time walking. Everything was gray.
So it was kind of like you had dementia or symptoms of dementia, right?
Oh, absolutely. Yeah. I definitely did. And they were increasing. I was fortunate they didn't get really, really bad, but still not being able to write your name is pretty significant.
Yeah.
The day after surgery, I was able to get up out of the bed and walk. Everything looked like somebody just turned the lights on and it was bright again. I could hear better. I could speak better. I was just really, really amazed. And that's one of the reasons I'm such an advocate for people with normal pressure hydrocephalus.
Welcome to Aging in Style with me, Lori Williams. I'm an optimist by nature, and I believe you can follow your dreams at any age. My grandmother's journey with dementia ignited a passion in me to work with seniors. I've spent the past 13 years learning about seniors and aging. In my mid-50s, I followed my own dream and founded my company where I use my expertise to help seniors locate housing and resources. On this podcast, we cover all aspects of aging. Join us each week to meet senior living experts and inspirational seniors who are following their dreams. The fact is, we're all aging, so why not do it in style? Hi, welcome to today's episode of Aging in Style. So several months ago, I was at a networking meeting. There was a speaker there, and his name is Gary Chaffee, and his story was incredible. And I've been wanting to have him on the podcast to talk about it because it's something, working in senior living as long as I have, I had not heard of this. So what we're going to talk about is NPH, or Normal Pressure Hydrocephalus. And it looks like Alzheimer's or Parkinson's, but it can be a treatable form of dementia. So Gary actually experienced this himself, and now he is a spokesperson for NPH, and his story is just incredible. I'm going to have him tell it. But let me tell you a little bit about Gary. He is 75 years old. He is a very active retired senior. He just told me he feels 18, which is amazing, and I love that. He was a U.S. Navy submarine veteran. He's been married for 56 years with 3 adult children, and he also had a long career in clinical laboratory science and allied healthcare. He is now working with the Hydrocephalus Association as a volunteer, and we'll get more into that. But welcome, Gary. I'm so glad you're here to tell your story.
Well, thank you, Lori. I really think that my story, too, fits in with the Aging with Style theme of your program. So you could stop me at any time for questions as I go, but I can just kind of explain where I'm at and how I got here.
I want you to tell your story because it is so powerful. But can you tell us first, what is NPH?
I'm really happy that you asked that at the beginning because very few people have ever heard of NPH. I know when we had that meeting that you attended, there was a lot of people in that room that are in healthcare. And I think there was only maybe one other person out of 25 that understood what NPH was. And I'll refer to it as normal pressure hydrocephalus, and then we'll scrap that term because that's just too much of a mouthful. So we'll go with NPH. And what NPH is it's a form of hydrocephalus that impacts usually people age 60 and above, but it actually can hit people at any age. And what it is, it's an abnormal accumulation of spinal fluid in the brain. If you think of your brain and kind of visualize it, your brain's enclosed in this hard case called the skull. Well, with hydrocephalus or normal pressure hydrocephalus, what happens is the normal regulation of spinal fluid production and elimination goes awry. And so what happens is all of a sudden you start to build up additional spinal fluid, and that spinal fluid is captured in these 4 reservoirs you have in your brain that are called ventricles. Now, normally those ventricles serve a good purpose of storing spinal fluid, which is used for cushioning the brain, providing nutrition to the brain. So ventricles are rather important. What happens is when that production of the spinal fluid goes awry, the fluid builds up, those ventricles enlarge, and as they enlarge, they start expanding and putting pressure on different parts of the brain. It's called normal pressure hydrocephalus, but it's a little bit of a misnomer because during the course of a day, you will have fluctuations in your brain pressure. But the real damage is done by the increase in the size of the ventricles. when I first got diagnosed with it, and they did a CT scan to show me, I looked at that cross section of my brain and it looked more like a soup ball than it did a brain. So it's really kind of incredible, and you can start to see why you'll develop symptoms along with it as those ventricles do enlarge.
Okay.
So that's kind of what it is.
Yeah. Well, okay. So tell us your story, like what happened, and how you figured out what was going on, kind of like from the beginning of the symptoms.
Actually, I started off with probably earlier than most people develop the hydrocephalus or find out about it. I really didn't have much in the way of symptoms. I went for an eye exam because I was having just a little bit of difficulty with my glasses, but I was only 34 at the time. So went in, the eye doctor was doing a field exam, where you have to find all those little lights in that, which we all hate. And he detected there was a problem there in my peripheral vision. So he had me have a CT scan to find out if I had a pituitary tumor, which was always an exciting thought. So I went to the hospital, I had the CT scan, and then they discovered I had this massive quantity of spinal fluid in my brain. Put me in the hospital for about 3 days to really evaluate, make sure that I didn't have tumors or anything else going on. So that, again, I was 34. I had 3 kids at the time. Youngest one was about 2 years old, and my oldest 12 years old. So kind of an exciting time. Came out out of the hospital, though, and this is back in 1981. There wasn't a lot known about normal pressure hydrocephalus at the time. And so what they decided with me was they didn't find anything drastic going on. So they called it communicating hydrocephalus, and let's move on. And it was, just wait and see. That's what I did. I waited to see what would happen for 24 years. And when I turned just about 50, that's when the typical symptoms of normal pressure hydrocephalus really begin to hit. In terms of the symptoms of normal pressure hydrocephalus, the doctors that know anything about it often refer to the 3 W's. That's wet, wacky, and wobbly. And that's the way they can remember, to think about normal pressure hydrocephalus, because urinary incontinence or frequency is a big problem. The gait gets really wacky. That's why it's confused with Parkinson's very often, because for me personally, my gait, I would freeze. Sometimes I'd be walking across the airport because I traveled a lot at that time. And it'd be like my foot would stick to the ground. And then it would take me a second or so to realize, no, there's nothing there. I should be able to walk, and I would walk again. So that went on for a while. And then the wacky part was also starting to develop. I was working at the time, but I found myself in a couple of situations where all of a sudden I didn't realize where I was at. I did that once or twice in the car in very familiar territory on my way home from someplace. And all of a sudden I realized I didn't know how to get home. And at age 50, that's kind of scary, because the first thing that comes to mind is Alzheimer's. So that happened a few times. And then it was even starting to happen when I would be traveling for work, and I'd be in Philadelphia. I love downtown Philadelphia and walking around. I'd get a few blocks away from the hotel, and then I had a struggle to find out my way back. Other little things along the cognition started to develop as well, as where all of a sudden I had a difficult time in writing my name. Fortunately, I was able to maintain my job for quite a while, but then finally got bad enough where I had to go on disability. And my company was great to work with me on the disability. And then we decided to move from, I went to a doctor, a neurosurgeon up in the St. Louis area, and he did some testing, and he said, no, I don't think you're a candidate for a shunt. I don't like the benefit versus the risk. Not going to do it. I was kind of put off by that at first, but in retrospect, I realized that was a blessing for me, because this was a neurosurgeon that really didn't have an interest in normal pressure hydrocephalus and didn't understand it.
Did he know that's what you had? Had he diagnosed you with it?
Right. He had diagnosed it, but decided to do nothing about it.
Okay.
And so things were going downhill pretty quickly. We lived in St. Louis. We decided we'd move to Texas to be closer to family because I could actually envision a nursing home in my future. That was a little bit of a difficult time, but thank goodness we made that move because I got a neurologist there who understood normal pressure hydrocephalus, immediately sent me over to a major teaching institution for a neurosurgery consult there. I have now been with that group for 18 years, and it's been an amazing transformation. I continued to work for a while, but then disability kicked in again, had to take off, and then they evaluated me for surgery. And for normal pressure hydrocephalus, the typical surgery is putting in a shunt that goes from the center of your brain and then drains into my abdomen. And that was an exciting experience to have them talk about doing that.
So did they do that? I'm sorry to interrupt, but did they do that when you first went to the doctor here in Texas, or did they treat you in another way before considering the shunt?
No, they almost immediately did the workup for a shunt. And what the workup for the shunt in a group like where I was at, it involved me going into the hospital for 3 days, and they put a drain in my spine, and they could do a controlled release of spinal fluid that way and evaluate me with neuropsychological testing. Physical therapist came in to evaluate the changes in my gait. And so between the neurosurgeons, neuropsychologists, physical therapists, and the nursing staff, they determined, I was definitely a candidate for the shunt, and then they scheduled the surgery. Got interesting, though, because during my stay at the hospital, one of the nurses mentioned to me that she didn't think I should have that surgery. My background is as a medical technologist, and we're kind of nitpicking about going through the research and knowing those details. So when the surgeons came in and said that they wanted to do surgery the next day, I said, time out. I've got to go home. I've got to do some research to make sure that's the right path. And that's what I did. Pretty immediately, and he said, that probably was stupid on my part because now I have a month to wait before I can have the surgery.
No. Well, is there a lot of risk involved or something? Why did the nurse think that you shouldn't have it done?
I think the nurse actually came from England and she had been over here. Treatment over there was a little bit different. If they just go ahead and stick a shunt in without doing some of the pre-test to make sure you're a good candidate, there are a number of risks involved because they are drilling a hole in your brain. The risks were there. In one way, I was glad I did the research because when I did get to the hospital, I was totally prepared for the surgery. I had the surgery, and that would have been like January of 2001. I remember waking up, I just envisioned going to the hospital and having brain surgery, and you're going to wake up and your head hurts and you've got a big old bandage all around your head. I woke up and essentially had a Band-Aid on my head.
Oh, wow.
It was pretty amazing that I had no pain. I had a little bit of pain from post-surgery, but very little. It was pretty much controlled just with some Tylenol. And so I was pretty amazed by that.
That is amazing.
I waited all this time, but the big thing about it was when I went into surgery, life around me was gray. I wasn't depressed, but everything, there was no vibrance to life. I just had a hard time understanding people. I had a hard time walking. Everything was gray.
So it was kind of like you had dementia or symptoms of dementia, right?
Oh, absolutely. Yeah. I definitely did. And they were increasing. I was fortunate they didn't get really, really bad, but still not being able to write your name is pretty significant. The day after surgery, I was able to get up out of the bed and walk. Everything looked like somebody just turned the lights on and was bright again. I could hear better. I could speak better. I was just really, really amazed. And that's one of the reasons I'm such an advocate for people with normal pressure hydrocephalus. Going into this, I had a lot of things going for me because I had a background in healthcare. I knew a lot of the terminology. I knew the way we were around the hospital and things like that. So I really felt sorry for people that are going through this diagnostics and the surgery and things like that when they don't have that kind of background. So I wanted to get myself in a position where I could offer some support. And that's what I've been doing now for quite a while.
Mm-hmm. Are a lot of people misdiagnosed? Is it, doctors don't always know about it, or what do you find?
Absolutely get misdiagnosed. In my case, it went through a variety of diagnostic things. One, they would work me up for Parkinson's disease, and then Alzheimer's disease. Another time that I got confused, and they even were starting to look at multiple myeloma and all these things. And every time they would make a misdiagnosis, that burnt up a lot of time and energy to go down that route of all the testing and stuff. So it happens quite frequently. The other thing that happens is it gets misdiagnosed, or just as you're getting older, those things happen. Your nerve frequency happens. Your walking happens just with increased age. I'm here to tell you, don't believe that. Just flat don't believe that, or push back to make sure what else is going on.
Mm-hmm. Okay, that's good to know. So if someone is having some of these symptoms, like you said, the way the doctors talk about it, it's wet, wacky, and wobbly. So if you're having urinary incontinence, some signs of dementia, and if your gait is off, if you're kind of wobbly when you walk, those would all be things that, it could mean Parkinson's, it could mean something else. But would you say, ask your doctor about NPH? Right.
The theme I've been using lately is, could it be? Just because that's pretty simple for everyone to remember. When you're looking at yourself, a loved one, one of your neighbors, your friends, and you start to see maybe they're not quite as responsive to you as they were, you can see they're having trouble walking, or if they are walking, that's in a hurry to the bathroom, and they're in that age group of, in the 60s usually. Don't panic about it, but just in the back of your mind, if you would please just say, could it be NPH? Well, that's one thing I'd want you to do. The second thing I would want people to do is, once you recognize that, talk to the person about it, because you can help create that awareness. So when they go to the doctor, they can ask that question of the doctor as well. Don't be surprised when you go to the doctor, or your friend goes to the doctor and he says, no, that couldn't possibly be it because you're not old enough. Don't believe it, because I've known people in their 30s that haven't. I know people in their 90s that haven't treated successfully. So it's not too young and never too old to have that on there. The nice thing about it is that it is treatable. So if you've asked that question, they can usually just do a CT scan, and that leads them in the right direction. If the ventricles aren't enlarged, then they go down another route and see what's going on. But the ventricles are enlarged. Doesn't automatically mean it's NPH, but it increases the likelihood. And for me, I think that's kind of exciting. It's like, rather than get diagnosed with dementia, Alzheimer type of dementia or whatever, if I could be diagnosed with something that they can treat, I'm all for that. And I hope that listeners of the podcast will have that same feeling, because it's amazing to me as I talk with doctors, the fact that they skip over that diagnosis when it is so easy. Now, in fairness to the doctors, technology has made it a lot easier for them. 10 years ago, people didn't routinely get brain CT scans like they do today. Now, that's much more routine, so they're liable to pick that up. I'm excited because since I've been working with the Hydrocephalus Association and being a peer volunteer and also working with some Facebook support groups, 10 years ago, if we got a request for somebody once or twice a month to be added to the group, that was something. Now it's 5 or 6 a day that I see. So the word is getting out there. We just need to increase that.
Absolutely. And that to me is just beyond tragic to think that there are people out there who are diagnosed with dementia and that's not what they have. They may have NPH, which is treatable. That's horrifying to think of.
Right now, the statistics show that somewhere around 5% of the people that are institutionalized for dementia actually have normal pressure hydrocephalus. I've got some case studies and things of people that have been treated that way. They've been actually inpatient or being treated at home with serious dementia, not being able to walk. Finally, somebody made the diagnosis. They got a shunt, And after years of not walking, can now walk and can kind of carry on a normal routine.
Wow. That's just amazing.
Doctors that I see all kind of expect from me nowadays that I'm going to have a talk to them about normal pressure hydrocephalus. And I'm not talking when I talk to my neurosurgeon, I'm talking about if I visit a pediatrician with somebody else in the family, that guy's going to learn about normal pressure hydrocephalus. If I go to an ENT doctor, I have my cards and information, and then we have a discussion about it. So that they know, they almost kind of expect it now. Okay, here comes Gary again. They don't forget it.
Yeah, that's your mission and your purpose now. Okay, so the only treatment is to have the shunt? Is that the only treatment available?
It's the main one that's available. There are surgery, brain surgery is involved in either case. Most of the time, at least in the United States, they will put in a shunt. Nowadays, the shunt is programmable, which I always kid people about. Is like, if I'm having a bad day, at least my brain is programmable, not so much for the other people. So they can do something with that. And that involves putting a tube into the center of the brain, a valve in my skull, and then it runs down within the body into my abdomen and drains. If I wasn't bald, then that probably wouldn't be much of a problem. Then nobody would actually really know that I had that there. There is another procedure that is gaining some popularity, and that's called ETV. And that way they don't put in any extra plumbing, but what they do is they drill a hole through your skull, and then they put a tube down in, or they go into the brain, and they put a hole in one of the ventricles to help it drain. That's usually reserved for people that their hydrocephalus has been caused by some type of bony structure or something that was obstructing the normal route. But increasingly over the last couple of years, they're looking at that more as a possible option for NPH. And I do know a number of people that have had that, and then maybe a year or two later, then they get their shunt.
Mm-hmm. Do you have to have the shunt changed out ever, or is it one and it's good, or does it have to be something that is replaced?
They should hire me for quality control for shunts, I think, because I'm one of those few people that does have to have the shunt replaced more often than most. Mm-hmm. I'm now currently on shunt number 7. So that means, I've had 7 brain surgeries.
Wow.
Most people with normal pressure hydrocephalus usually get by with 1 or possibly 2. More and more of the statistics starting to say after about 5 years, people have a tendency maybe to need a new one. Like I said, I was an overachiever, so I last about 3 years.
Do you notice when it needs to be changed out? Do you just start having your symptoms come back, or what happens?
That's absolutely what happens. All of a sudden, the symptoms will start coming back. Usually it's gradual. Urinary frequency will increase, stumbling with the words, having a difficult time finding words, and some of those cognitive types of issues come back. I've never had it come back, the cognitive issues, so bad as it was before my shunt, but they do come back, and then my walking gets terrible. Those are the top 3 symptoms, but for me and for a number of other people, things that will happen too is speech will start being impaired. And for me, my hearing gets impaired. Mm-hmm. And for me, that's the last couple of shunts I've had. Actually, hearing was one of my major issues that I was hoping it would get resolved. I went from being almost totally deaf about 5 years ago to the day after surgery, being able to hear again. I actually had to go to the audiologist. I had to turn down my hearing aids because my hearing aids were turned up too high that they were blowing my head off. So that's what happens. And I tell people, I don't get too concerned about it because when my shunt is working, I do what I can do every day and just enjoy life. In the back of my head, I know what the signs and symptoms are, and I know when it's time to go in and get a consult for doing that. I tell people, too, every once in a while, I think the good Lord just likes to remind Gary who's boss. and that the value of my shunt, because when the shunt's not working, life becomes miserable again. And the day after they replace my shunts, the lights come back on. I can walk, talk, and all that. So
It's so interesting because it does make you wonder, like people who have different forms of dementia, is that how life is for them? Like gray, like you said, everything just seems gray, and then if you didn't have it, the lights are back on. So it does make you wonder, is that how people with other forms of dementia feel?
Yeah, I've thought about that myself. It's like, I know how fortunate I am that I bounce back.
Yeah.
But being on the edge there of that kind of reality of what goes on, the people I know that do have other forms of dementia, seems like that's where they're at, where things kind of gray out. And then one of the other things I noticed with me, and it's a tip-off for me, is when I no longer want to go out and socialize or party, because I can no longer really keep up with the conversation. The brain just goes so slow that I'm way behind in the conversation and become uncomfortable. So then I stop going out. And then like my neurosurgeon, we kind of joke about that. He says, yeah, you become kind of isolated when you have the problem and you don't talk much. And then after surgery, we can't shut you up. So.
Well, and that is definitely something we see with people with dementia, is that they begin isolating. And that makes perfect sense, because if you're sitting there and you can't keep up with the conversation, that has to be very uncomfortable. You would want to isolate in that situation. So, well, I'm so thankful to have you here sharing your story. And I just, I want to help you spread the message and get it out there, because if we help just one person, I mean, that's, one person whose life is completely different. And Gary, you are a big volunteer with Hydrocephalus Association. You said you're going to be speaking at some events. So tell us about that.
I was really excited that this year, the conference, which it's to have every 2 years, is going to be down in Austin, Texas. So it's a little bit closer for me to be able to travel to that. So I was really excited. But then they asked me to be a speaker on the group at the conference. And actually, I'll be a cross-generational type of program that I'll be on. It'll deal with thriving with hydrocephalus. I have written a paper that's on the Hydrocephalus Association about thriving with NPH. Because my story there with thriving with NPH was, once I had my surgery but I was still disabled, and I was sitting on my patio in a rocking chair. And anybody knows me as I'm not the rocking chair type. And so it just dawned on me that I had to do something different. And so that was a story I wanted to tell people. Once that light went on, that I knew I had, if I tried to live my life the way I had before, do all the same things I had been doing before, all I was doing was frustrating myself. Because now, even though I'm much better with my shunts, I still have some cognitive issues that I have to deal with. So it was like going up against a brick wall trying to do some of those things. So once I realized that, then I picked up a pencil and a piece of paper, and I've never really been an artist or draw or anything like that. I took the time and I did that. And I can remember it was a rabbit that I drew. And I looked at that rabbit and I said, "Oh, darn, it's a rabbit." And then from there it started, I got enthused, started doing more, took a couple of classes. And to make the story a little bit shorter, now I paint. I've actually, one of the paintings I'm proud of is a portrait of my neurosurgeon.
Oh my goodness.
So, for me, that was kind of exciting, because I was just telling somebody the other day too. The other thing is that now, where before I had my office wall with all my diplomas and certificates of achievement, they're all gone. That was my past life. Now I have my artwork and my wife's artwork up on the wall, and we just kind of enjoy life doing it that way. So hopefully that's a message that you can get out as well too. Sometimes you just have to change it up. And for me, that worked out well.
Yeah, you started a new chapter, and that's amazing. Did you give that portrait to your neurologist? He
has seen the photo of it. He chuckled a little bit, because we both agree he was a lot younger when that photo was taken.
That's funny. Well, how can people find out more about hydrocephalus? I know there's the association. Can you give us the website for that? And you also mentioned there's Facebook groups as well.
Right. Yeah, there's a lot of resources that are now available for people with hydrocephalus that were not available when I first was diagnosed. The Hydrocephalus Association is probably the largest organization, probably in the world, for dealing with all types of hydrocephalus. They do a lot with the research. They do a lot with education of the community, education of physicians. Their website was just reworked about a little over a year ago. Terrific amount of information that's on there. You can find that at Hydro Associate. Actually, it's HYDROASSOC.org.
Okay. We'll put it out there too.
It's got tremendous amount of information. But one of the things I would like to highlight on there was that I am a peer volunteer. And so anybody in the country, whether they're a patient or a loved one, or anyone needs information about that, they can call the office. They will set you up with a peer volunteer. For normal pressure hydrocephalus, there's only a few of us in the country. So in a given week, I probably have 2 to 3 patients anywhere in the country that walk through things and talk about it. It's helpful for me because the more I can talk about it, gets it off my chest. I realize I'm not alone. And if I can put myself in a position where I'm helping people, it just makes my day a happier day. So hopefully I have helped some people.
Yeah,
so
I'm sure you have.
Excellent information there. There's also a physician directory on there. And we don't just automatically put doctors on there. They have to request to be added to the site. That tells us that they have an interest in the normal pressure hydrocephalus, gives all the information about their facility or how to contact them. So that's an excellent resource. But while we're talking about that, finding a physician to go to, I really want to make this very clear because there's really only a few centers within the United States that really do an outstanding job in treating normal pressure hydrocephalus. And again, that's my personal feeling, and that's just, I've seen it time and time again. Virtually any neurosurgeon in the country can put a shunt in, but you really need to have somebody that has the interest in normal pressure hydrocephalus and has the expertise in doing that shunt correctly and will provide the follow-up care. Typically, those are places that are large institutions, teaching hospitals, because they have more of they see more patients in that category and they have the resources to handle it. So I go to UT Southwest. Johns Hopkins is another big one. But if you could go to that website, that can help.
Okay, excellent. Well, I appreciate you so much being on the podcast and sharing your story and sharing the information about NPH so people know about it. And then I love that you have found a new purpose, found your art, but also the purpose of helping other people and getting the word out about NPH. So I just applaud you for that. We will put the information, the website, make that available to everyone. We'll have it on on my website too, because it's so important for anyone out there who, even if it's just maybe a chance that it could be this, it's worth looking into, rather than being diagnosed with a dementia, here's something that's actually treatable. So thank you so much, Gary.
Well, thank you for having me. And just for everyone, just remember those 3 little words, could it be?
Could it be? Okay. I love that. We'll leave you with that. And thank you so much for listening to the podcast. If you would like to find other episodes that we've done, you can just go to my website, which is LoriWilliams-seniorservices.com. And please share any of the episodes, especially this one. Please share it with your friends and family. You never know who it may help. We'll see you next week.